Ladies and gentlemen, welcome to a new episode of Explore and Engage with Anam. Transparency is a good thing, especially when it comes to pricing in the healthcare industry. Patients, for a very long time, have been confused about the prices of healthcare services. Even today, it is not clear to most patients what various healthcare services cost. People usually know if they have a copay. So if you are a patient and you are visiting your primary care doctor, if you're visiting the clinic to see your primary care doctor, and you have the basic knowledge about your insurance coverage, then you may know how much your copay is going to be. It could be $25, it could be $50, or some other figure, but that copay is not the total cost of the visit. That's not the complete price tag of that particular visit. The copay is what you pay as a patient, but there's a much larger amount that may get billed to insurance, and then the insurance company probably has negotiated an arrangement with the medical provider, in the case of an in-network provider, to pay a certain amount. That's something that most patients probably do not pay attention to. The agreement, the negotiation between the provider and the insurance company, that's probably something that the patient doesn't pay attention to. The patient probably just knows what he or she has to pay for a primary care doctor visit, the copay. Now, things get complicated when you're looking at more detailed services. So if you visit the emergency room and you end up being hospitalized, or if you need to undergo surgical procedures, or if you need medical devices or more complex services, that's when the costs can keep rising, and you as a patient may have to spend a lot more out of pocket. It all depends on what kind of coverage you have, what your yearly deductible is, what your copay is, it depends on the level of coverage that you have. And also the kind of coverage. Do you have employer-sponsored health insurance, or do you have private individual coverage or public insurance? There can be a variety of circumstances. But there's one problem that most people are likely aware of, and that is there's a lack of price transparency. Patients don't know how much the healthcare services cost, and people don't know how the prices are set. It's not like buying a car, and I use that as an example. It's not like buying a car. If you like a certain type of vehicle, whether it's a compact SUV or a full-size SUV or a mid-size sedan, whatever the type of car that you like, you can actually go to different dealerships, check out different brands, and see where you get the best deal for a compact SUV. And even within a particular brand and a particular type of vehicle, you can go to one dealer, and then you can go to a different dealer and see who's offering a better deal. So you can look at the prices, you can look at the different offers and the incentives that are out there if you're buying a vehicle. But in the case of healthcare, people usually do not have the time to compare prices across different providers and facilities. If you need a certain healthcare service, then you may not have the time to call up different healthcare providers and ask them how much they are going to charge for that particular type of service. Or you may not need, or you may not know what kind of services you need. You may just know what symptoms you have, and then you have to go to the doctor, the provider, to actually to actually find out what the diagnosis is. And based on the diagnosis, there may be different services available and recommended. So it's much more complicated when you're talking about healthcare. It can be much more confusing, and people do not have the opportunity to call up different providers and do price comparison. It can be very, very confusing. And even if somebody tries to compare prices, the information that the health systems might give you would be estimates. So if you need a particular surgery and you know what kind of surgery you need, if you call a certain health system, they may give you an estimate. If you call a different health system, they may give you an estimate. So it's an estimate. What you would likely get is an estimate, and it may not be the actual price that appears on the bill after you receive the services. And my friends, that's why people are so frustrated. The American people are extremely frustrated with the lack of transparency in healthcare pricing. There's really no transparency. And even doctors who are providing the services will likely agree. If you talk to doctors, they may agree. They may say, let me just give you an example. You go to a large healthcare system and you see a doctor. And you ask the doctor, hey, how much is my bill going to be for this service, for this visit? The doctor may not know the answer because there's a massive bureaucracy that handles that part. There's coding, billing, insurance. There's a huge bureaucracy in the healthcare system. So if you go to your primary care doctor, you go to a specialist and you ask, doctor, what is going to be the fee for this visit? They may not know the answer. And there are reasons why people are so frustrated. A lot has to do with pricing, the financial part of healthcare. And I studied healthcare policy. So I'm a healthcare policy analyst by training, but you don't have to be a healthcare policy analyst to figure out that there's something very wrong with the healthcare system. And so transparency, price transparency is extremely important. So here's what's going on. I talked about the issue. I gave you some examples. I talked about the overall problem. And now let me tell you what's going on, what's being done about it. I'm going to share with you the latest information from the new administration, the Trump administration. President Donald J. Trump has taken action on this matter. There's an executive order that he has signed. And if you visit the website of the White House, you will see the information about the executive order. It is titled, the document that I saw on the website of the White House, it is titled, Making America Healthy Again by empowering patients with clear, accurate, and actionable healthcare pricing information. And this document is dated February 25 of 2025. And I'm going to read to you one paragraph from Section 1 of this executive order. So what I'm about to tell you now, this is language from the executive order, and let me read this. During my first term, my administration took historic steps to correct a fundamental wrong within the American healthcare system. For far too long, prices were hidden from patients and employers, with inadequate recourse available to individuals looking to shop for care or obtain pricing information from healthcare provider in advance of a visit or procedure. These opaque pricing arrangements allowed powerful entities such as hospitals and insurance companies to operate with insufficient accountability regarding their pricing practices, resulting in patients, employers, and taxpayers shouldering the burden of inflated healthcare costs. My friends, what I just read, this is a paragraph from the executive order, which President Donald J. Trump signed. And I'm going to read to you another paragraph, okay? Pursuant to Executive Order 13877 of June 24, 2019, improving price and quality transparency in American healthcare to put patients first. This was the executive order that President Trump signed in 2019. So let me read this again. Pursuant to Executive Order 13877 of June 24, 2019, my administration issued paradigm-shifting regulations to put patients first by requiring hospitals and health plans to deliver meaningful price information to the American people. These regulations require hospitals to maintain a consumer-friendly display of pricing information for up to 300 shoppable services and a machine-readable file with negotiated rates for every single service the hospital provides. Health plans to post their negotiated rates with providers, as well as their out-of-network payments to providers and the actual prices they or their pharmacy benefit manager pay for prescription drugs. And health plans to maintain a consumer-facing internet tool through which individuals can access price information. So President Trump, in the current executive order, he's referring to the past executive order that he signed during his first term in office. So President Trump writes that progress on price transparency at the federal level has stalled since the end of his first term. During his first term, President Trump made progress regarding price transparency at the federal level. But then, when President Trump left office, the progress stalled. That is what happened. President Trump was making great progress, but as soon as the Biden administration came to power, the progress stopped, and then the work was not complete, and that is why President Trump is taking action now. So Section 2 of the executive order that he signed this month, I'm going to read to you a section. I'm going to read to you from the policy section of the order, okay? It is the policy of the United States to put patients first and ensure they have the information they need to make well-informed healthcare decisions. The federal government will continue to promote universal access to clear and accurate healthcare prices and will take all necessary steps to improve existing price transparency requirements, increase enforcement of price transparency requirements, and identify opportunities to further empower patients with meaningful price information, potentially including through the expansion of existing price transparency requirements. So this is from the policy section of the executive order that President Trump signed. And my friends, this is a great action coming from the Trump administration, an executive order by President Donald J. Trump. And if the administration is successful in this effort, then there will be significant improvements in the overall healthcare sector. Now, the healthcare sector has many challenges. I think we all understand that. And there's no quick solution. There's no magical solution that will fix everything. We have to take the right steps towards making high-quality healthcare services accessible at a cost that people can afford, and of course, with price transparency. And I believe that the Trump administration will take the right steps. This executive order by President Trump is obviously a great one. And I read to you some paragraphs from the executive order from Section 1 and also Section 2, which is the policy section. And I think you understand that this administration is taking the right steps, moving us in the right direction, promoting price transparency, doing everything possible to ensure price transparency. And price transparency in healthcare is something that we all want. American consumers want price transparency in the healthcare system. And I look forward to seeing more great things happening very soon. So I applaud President Donald J. Trump and his administration for taking the right steps. And I'm looking forward to seeing what else will happen in the days, weeks, and months to come. So, my friends, share with me your thoughts. You can visit my website, tausifanam.net, and once you are on my website, you can send me a message through my website. You can also sign up for my e-newsletter. You can also email me directly. My email address is tausif@tausifanam.net. You can also find me on social media. I'm on Facebook, I'm on Instagram, I'm on X, and I am on Truth Social. Thank you so very much for continuing to listen to my podcast, and I hope to be back again soon with a new episode of Explore and Engage with Anam.